All right, so in this video, we're going to be discussing the arms of the brachium, or the arms that surround the humerus. There's only 4 of them, so this one should be a pretty short video, but I like to say that and things not go the way I want them to. All right, we're going to start today with we're going to start in this video with the triceps muscle, as you can see here. Now, triceps is 3-headed, so tri, 3, sep, head. So it's 3-headed muscle, so it has 3 origins on it. The long head here is the only one that crosses the shoulder joint. This actually goes up to the infraglenoid tubercle. Let's isolate that muscle so we can kind of see it. It goes up here to the infraglenoid tubercle, and then back and then down here to the olecranon process. You have the long head here. You have the lateral head. Oh, it's gonna make me go back. We have the lateral head here. There it goes. It likes to take forever sometimes. And that goes from the shaft, the posterior shaft of the brachium, all the way down to that olecranon process. And then you have the medial head here, which is going to be kind of deep. It's going to be deeper, so you're going to have to go through either one of the other 2 heads to get to it when you're massaging. But this one attaches at the posterior medial shaft of the humerus, and then goes down, and so all 3 of them go down and attach into that olecranon. So the actions that this muscle is going to do is it's going to do this lateral head, or the long head here, is going to do, is since it crosses the shoulder, it's going to actually do some extension of the shoulder, so extension of that glenohumeral joint, and then all 3 of them working together are going to do extension of the elbow. So that extension of the elbow, when you're having to push up and use that tricep, this is the only muscle that's doing that extension of the elbow. All right, so now we're going to move on. We're going to add in another muscle group here, or another muscle. All right, so then we have the coracobrachialis. Coracobrachialis goes from the coracoid process down to I'm hoping it's going to highlight at some point. There you go. From the coracoid process down here to the middle shaft of the humerus. Because of where this is located, it is going to do just slight adduction of the shoulder, and then it's going to do a flexion of that shoulder as well. So this is going to assist with that flexion. Now, this muscle we don't typically we don't isolate as a massage therapist. We don't really get to it because it is just deep to the biceps. So we're going to add in some more, and you can see that biceps there. Now, before we move on to the biceps, though, I do want to address the muscle that is underneath the biceps. Now, this is the brachialis muscle. Brachialis muscle attaches at the, so we're going to fade the others, see if we can see where that's located. So the coracobrachialis comes down and attaches right here. Brachialis attaches just underneath that, and then goes down and attaches at the ulna. We'll even isolate that so we can kind of see where that's going. This is going to do flexion of the elbow. So this assists with flexion of the elbow along with the brachioradialis and the biceps brachii. All right, and then the big muscle that we all know is going to be here, and this is going to be the biceps brachii, bi meaning 2, bi meaning 2, and then sep as in head. So it's got 2 heads and 1 attachment. So it's got 2 origins and 1 insertion. This is the long head. This is going. Oh, sorry, short head. I know it's long. It looks longer, but it's not. Short head. Short head of the biceps. Here goes up to attaches the coracoid process, and then this is the long head. Now, if I isolate this one, you see how that's longer as it goes actually longer. So if we were to bring this up, it would be way over here. So this is the one that goes in that intertubercular groove and kind of right on top of that synovial membrane of the ball and socket joint. that glenohumeral joint, and both of them come down and attach down here into the radial tuberosity of the radius. It doesn't attach to the ulna, it attaches to the radius. So this is not just going to do a flexion of the shoulder and flexion of the elbow, but it's also going to do supination. So if you make a fist and hold up your biceps where your fist is facing towards you, and then if you turn your hand away, you can see that bulge move. So this is going, that biceps really gets into that flexion when you do add that supination in there. Okay. All right, so that's going to be it for this video. Stick around. We're going to start talking about the muscles of the forearm and the hand.